Michelle, this is Lynn at San Diego Police Department. Is this your husband or boyfriend?
My husband.
It's your husband?
Yes.
Okay. Does he have any weapons at all?
No.
What did he do to you? Okay, I want you to try to take a deep breath and calm down. He did what?
He tried to break my neck, and he suffocated me when I was trying to get the door.
Okay, do you need a paramedic? Okay, Michelle, do you need a paramedic?
No.
Are you sure?
Yes, I'm sure.
Hi, my name is Casey Gwynn. I'm the president of Alliance for Hope International and the former San Diego City Attorney. We run what's called the Training Institute on Strangulation Prevention. It's the largest program of its kind in America, training police officers, prosecutors, paramedics, EMTs, doctors, nurses, advocates, and people that work in the field that deal with cases primarily of domestic violence, but strangulation assaults come up in elder abuse, in child abuse, and in sexual assault cases. And our goal in this video is to really help you better understand what's going on in the dynamics of a strangulation assault so that when you're providing medical care and medical diagnosis, you're able to provide the best service possible.
Almost every state has passed a felony strangulation and suffocation law. State, federal, and tribal codes recognize that strangulation can result in great bodily injury and poses a substantial risk of death.
Hi, this is Jim Dunford. I'm the City of San Diego EMS Medical Director, and I'm here to talk a little bit about this important program that the City of San Diego first responders are about to take on. There's nothing really more important than identifying a potential cause of death. That's what EMS is about. And for years, I think there's been a lack of recognition of just how critically important it is for us to identify potential strangulation injuries. These calls come in as assaults. Police, fire, and EMS are routinely called to these cases every day. But we've really never done any serious training to identify what are some of the important histories that would indicate that somebody might have actually suffered a potentially life-threatening injury. The important historical components of a woman who's been strangled, loss of consciousness, incontinence, these important histories have never really been brought out, not only in EMS, but actually in emergency medicine itself. So I'm really taking this project on in collaboration with police, fire, and EMS to make San Diego the first city in the country that can really recognize the history that a woman will give to us at the scene, and for which she's either humiliated, scared to death, or needs some other kind of psychological support in order to be able to get the right medical assessment.
Hi, my name is Gail Strack. I'm the CEO of Alliance for Hope. I get to oversee the Training Institute on Strangulation Prevention. I'm really excited about this video to train paramedics about domestic violence and go into strangulation. In 1995, we had 2 teenagers that died. Before they were killed, they were choked. And in San Diego, we missed it. We did not understand the significance of that type of assault. But today, we know how serious and how lethal strangulation can be. Unconsciousness can happen within seconds, death within minutes. We also know that if a victim has suffered petechiae, loss of consciousness, urination, defecation, or vision has been impacted, that person has just suffered a life-threatening injury.
Hello, I'm Dr. Bill Smock. I'm the police surgeon for the Louisville Metro Police Department. Thank you for joining us today on this educational training regarding strangulation and the importance of your evaluation of the victim who has been strangled. Every patient who gets strangled, they need a medical assessment. You can have injuries to the thyroid cartilage. Since we know it takes 4 pounds to collapse the jugular, 11 pounds to collapse the carotid, 33 pounds to collapse the trachea. If a patient says they couldn't breathe, as you're getting the history, that says that there was at least 34 pounds of pressure applied to the trachea if they can't breathe. Other things that can go wrong. We know the thyroid gland is right there over the thyroid cartilage. If you touch the thyroid and you squeeze the thyroid, which is it's very common during strangulation, you may have the release of thyroid hormone. So these patients are going to have increase in blood pressure, increase in heart rate, maybe increase in temperature. And what happens with someone whose blood pressure may go up? They may stroke, not from an embolic event, but from a cerebral hemorrhage. So there are all sorts of traumatic things, bad things that can happen when you apply pressure to the neck.
We are very excited about the Strangulation Assessment Card. It's a new tool designed by paramedics for paramedics. A mnemonic checklist using the word strangle will help you remember some key points. Let's go through the checklist together. Scene and safety. Take in the scene. Make sure you and the victim are safe. Trauma. The victim is likely to be traumatized. Be kind and be patient. Start by asking some simple questions like, what do you remember and how are you feeling? Reassure and provide resources. This is a great time to let the victim know that this is not her fault. Let her know that help is available and provide her with some local resources. Assess. Let's assess the victim for injuries from head to toe. The signs and symptoms of strangulation are listed in the assessment card. And don't forget about traumatic brain injury. It is very likely that the victim has suffered a history of domestic violence or multiple strangulations, and maybe even both. Notes. This is a great time to take good notes and document your observations. Please make sure to put the victim statements in quotes. Give. Give the victim information about strangulation. This may be the only time anyone can explain how serious strangulation can be. Let her know about the delayed consequences as well. Look for signs of loss of consciousness. Loss of consciousness is a life-threatening injury and the victim should be transported to the hospital. Encourage. Encourage the victim to seek medical attention anytime you find evidence of life-threatening injuries.
In strangulation, not all the injuries that we can see are visible. Actually, a substantial amount of injuries are actually under the skin that we can't see, which is why we need to send these people to the emergency department for some additional evaluation. Since in San Diego you have the ability to record when you turn the monitor on, get those questions and their answers on that audio tape, and the police may be able to use that, because what happens in cases of domestic assault is a lot of times the victim will recant. They may be threatened. But if you've got that audio tape and you're working with those detectives, download that tape and give it to the investigating officer. That will help make the case. Document what they say, because that history is also very, very important.
Petechiae can be easy to miss. You need to carefully look for tiny red spots on the face, in around the eyes, behind the ears, inside the mouth, and even the scalp. Let's take a look at a digital video that shows how petechiae occurs.
The digital video that you're seeing on the screen right now is a digital image of a strangulation assault. And you'll see as the hands come onto the neck, they first make contact with pressure on the jugular veins. As you all know, the jugular veins are closest to the surface of the skin. When somebody is manually strangled or strangled with a ligature, the first occlusion happens to the jugular veins. So in this video, you can see the jugular veins are being occluded. The good blood is still going up to the brain and the carotid arteries. You can see that as well, but it's not coming back down in the jugulars. The good blood's going up, it's not coming back down. That's creating that pressure in the brain that produces petechial hemorrhages. And those petechial hemorrhages that you see showing up around the eyes in this image are evidence of a noxic brain injury. When you see external petechial hemorrhages, you have evidence of internal brain damage that has happened because of the pressure of a chokehold on the victim.
Good afternoon. My name is Dr. Vella, and I'm a detective with the San Diego Police Department, and I'm here to talk to you today about trauma. When responding to a scene, oftentimes the victims are in a great deal of distress. There are many different things that are going on for the victim. For example, she may be in a lot of pain. She may be worried about what's going to happen with her children. She's worried about what are the consequences if she was to disclose anything to law enforcement and or medics. So the dynamics of domestic violence is multifold. There's many different things that has to be considered. The pain and the fear are the top two factors that need to be considered. Domestic violence victims also are so fearful of what is going to happen in the relationship because they're worried about the money, they're worried about where they're going to go, who's going to feed the cat and the dog, who's going to take care of the children. What is required is that when responding, that there is an element of human kindness. There has to be that empathy. Some of these victims have never experienced empathy before, so they don't understand, and it even feels awkward for them if you are going to talk nice to them. So I would encourage you to be very relaxed with them. Be patient. Don't give up on them. Keep asking the questions. Let them know that they didn't deserve to get beat up, because it's oftentimes that's all they know. And having the kindness of someone in uniform will speak volumes. So please don't give up on your victims and keep asking those difficult questions.
You're now going to see two different scenarios inside this training video. The first scenario is often what is typically going on when paramedics or EMTs arrive at the scene of a domestic violence strangulation assault. The victim's uncooperative, the victim is scared, the victim doesn't want to have medical attention, and you'll see in this first example really the wrong way to deal with a victim of strangulation assault. Then we're going to reset the camera and you'll see the right way. The way the San Diego Fire Department and the whole team wants you to be handling these cases. The city of San Diego has an opportunity to become a national leader in this. So this example that we have basically filmed for you of a mock situation in a crime scene when you're dealing with a strangulation assault victim, this is the model that we want to see happen across San Diego and across America.
Hi, what's your name?
Rena?
Rena, my name is Mitch. I'm a firefighter paramedic with San Diego City. Are you hurt anywhere?
I'm fine. I'm
Can we check you out to make sure that you're okay?
I can't, well, no, I'm just, I'm fine. I don't want to go to the hospital or anything. I'm fine.
Can we at least check your vital signs, or you don't want any help at all?
I'm fine. There's nothing wrong with me. I'm just,
Do you hurt
just a little
anywhere?
bit shook up.
Do you
Not
hurt
really.
anywhere?
Not really.
You remember what happened?
Yeah.
Okay. Well, if you don't want to go with us, you don't have to go. That's your right. Can I ask you 3 simple questions?
I guess.
Okay. Your first name is Remy. What's your last name?
The first name is Rena.
Rena. And what's your last name?
Hernandez.
And what city are you in?
San Diego.
And what day is today?
Wednesday.
And you definitely do not want to go to the hospital. You do not want an evaluation.
No, I'm fine. Really,
Good?
honestly.
Okay. I guess we're going to leave then. I'm going to advise San Diego PD that you did want our help, and we're going to go.
Okay.
Have a good day, Rena.
All right.
If you need help and you decide later, please call us back.
Okay.
Thank you.
Now let's watch the second scenario with well-trained paramedics doing it right.
Hello. My name is Mitch. I'm with San Diego Fire. I'm a firefighter paramedic. I understand you've been involved in an assault. Are you hurt anywhere?
No, I'm fine. I'm actually.
Okay. We'd like to check you out to make sure that everything is okay. Can I check your heart rate?
I'm really fine, you guys. I'm
What was your first name again?
Rena.
Rena, I would really feel comfortable if you at least let us check your vital signs and provide a basic exam just to make sure that everything's okay.
Okay.
Is that all right?
I guess.
Okay. Heart rate appears to be normal, regular, strong, probably about 100 at the radial
I'm
site.
really sorry.
It's
Is that sore on that side?
It is
Okay.
very sorry.
Let me take a quick look and I'll look on the other side, and we'll put this on the other side.
and what was your first name again?
Rena.
Rena. Let me ask you a few things real quick. Do you remember what happened?
Yeah.
Can you tell me what happened?
My husband grabbed me and threw me on the couch and punched me.
How long ago was that?
It just happened.
Was it 20, 30 minutes ago, an hour ago?
I probably about 10 or 15 minutes ago.
Okay. And obviously, we met with the police outside, and this is safe right now for us to be here. Do you hurt anywhere?
My neck hurts.
Okay.
My
Do you
arm
have
hurts.
your arm hurts? Do you have trouble breathing or swallowing?
Swallowing hurts, but I
Okay.
can breathe.
We're gonna look at your heart also. Can you hook up the EKG, please?
You want me to come this? Okay. And Mitch also just let you know blood pressure is 120/80, pulse of 98, and 99% O2 sat.
Okay, I'm gonna listen to you breathe. Deep breath, please. Again. Again. Does it hurt when you take a deep breath?
A little bit.
Okay. Do you have any vision problems?
Not right now.
Did you have before we arrived?
Well, I think I passed out.
Okay, did you see anything? Or did you have any visual disturbance?
I was kind of dizzy.
Okay, did you have any hearing? Did you hear anything? Any problems hearing?
No, I heard my kids screaming and crying.
Okay, so do you remember everything that happened?
Well, I remember most of it, I think, because
Okay.
I was on the couch.
Let me touch your neck here. Does this hurt back here?
Yeah.
How about here?
Yeah, that's sore.
Okay, it looks like there's some redness, arrhythmic and edema to the area behind her ear on the right and her neck. Can I look at this side? There's a little bit here also on her left side and some petechiae behind her ears.
How are my kids?
Your kids are fine. They're with the police officers. Can I just ask you if you have pain if I touch here?
Yes.
Here?
Yeah, I have that.
This arm.
Right there, yeah.
How about this arm?
No, that one's fine.
Right here?
Just my upper arm, there's a bruise. I think it's really sore.
Okay, looks like there's some redness and some ecchymosis, maybe a little bit of swelling to the upper arm on the left. Any pain in your stomach?
No.
Okay. Down here in your hips?
No.
Legs? Pull up with your toes, push down. See my two fingers? Grab these two fingers, squeeze. Harder, harder. Okay, let go. I'm gonna hold up your hands. Okay, I'm gonna count to 3, let go. 3, 1, 2, 3. Okay, that's good.
Normal sinus rhythm. I'm gonna go ahead and take these off now. We'll take off this one.
Did you drink any alcohol today?
No.
Are you diabetic?
No.
Okay. Apparently the officers told us that you might have actually had an accident, you might have urinated on yourself. Is that true?
Yeah.
Did you change clothes?
I did.
Okay. Well, our concerns are that there might be something going on, and we would like to take you to the hospital, have a doctor check you out. Is that okay?
I can't leave my kids, and I don't have insurance, and really, honestly, I feel fine.
I wouldn't worry about your children. Your children are going to be fine. They're with the police officers. Our concerns are right now your health. Can you open up your mouth? Let me see. Stick out your tongue. Okay, open up your eyes real wide. Close. Open. Okay, let me look to the right, look to the left, and again here. Okay. Well, she doesn't have any injury to her eye, but she definitely has discomfort on her neck, and she has the petechiae and the arrhythmic red areas behind her ears and her neck. So our concern is that there's a possibility that there might be something inside that we can't see. I don't have x-ray eyes. So you need to go to the hospital, and we would like to take you to see a doctor that can evaluate you, do an x-ray, possibly a CAT scan in a controlled environment, and everybody there that can make sure that there's nothing wrong. We actually are very concerned for your welfare right now.
Yeah, I really don't think I need to go. I really don't.
Well, I'm going to ask you 3 simple questions. You don't have to go if you don't want to. That's your right. And if you can answer these 3 questions, we'll go over procedure of what you can do. I strongly suggest you go with us. That's what we advise. If you decide not to go, you'll sign a form saying that you refuse and release us of liability, and all the risks and complications were given to you so you can make a sound judgment. What is your last name?
Hernandez.
And where do you live?
San Diego.
And what day is it today?
Wednesday.
Okay, she seems like she's alert and oriented, appropriate. She's got clear speech. I think there might have been a loss of consciousness. I'm going to call the hospital and do a radio report right now.
Go ahead and do the release.
And start the process of having a name.
I know my partner Mitch was talking to you and how concerned he is. We are very concerned about what's going on today. You know those little things he saw in the back ear? That's called petechiae. And what that is essentially that's external injury. And if you have that external injury signs, that means you have internal injuries inside and potentially brain damage.
Well, like what? What's going to happen? I mean, I don't feel lightheaded. I can breathe. I'm a little banged. This is not the first time I've been banged up.
And that's even more concerning to me now. Let's say it's not the first time, because these injuries, the more it occurs, the more damage you already have, and potentially that potential cause can lead us up to death. You may feel fine within 72 hours. Problems can occur, such as you might have some swelling in your neck. where it feels like your airway's closing up on you and you won't be able to breathe at all?
We would like to have you transported, and we can do that right now if you wish, and that's our concern, is to make sure that you're okay and you're evaluated and everything checks out, and you could hopefully be home within a few hours and reunited with your kids.
Okay.
So.
Okay.
Okay, thank you. I appreciate your cooperation, and I'm sorry that this happened to you. You didn't deserve this, and we'll give you a safe ride to the hospital, and hopefully everything will check out. We'll reunite you with your children. Thanks.
It's critical that first responders not rely upon the information solely given to them by law enforcement, but conduct their own assessment of the patient.
California now requires law enforcement to warn victims about the seriousness of strangulation and to seek medical attention. While there is no legal duty for EMS, the law makes sense and every professional should warn victims. Victims have a right to know.
Our role as a first responders is just that. We're first on scene. We're the first to detect that there is an issue or a problem medically. Our beginnings of picking up some pieces of the puzzle help in formulating a treatment plan and ultimately maybe even a prosecution if there's indeed a crime involved.
We recommend you leave a copy of the strangulation assessment card with the victim. It contains advice about the next 24 hours and encourages medical attention if the symptoms continue. It lists the National Domestic Violence Hotline number and recommends that she should talk to an advocate about local resources and safety planning. In the event she needs to seek medical attention, there is notice to the medical provider about our new imaging recommendations.
Hi, I'm Jacob Blevins. I'm a patrol officer for the city of San Diego, San Diego PD. When I get a strangulation type case, it's important to ask certain questions such as how much pressure was applied during the strangulation, how many hands were used, how long do they think that they were unconscious, if at all, and what caused the suspect to stop. Questions like that are very important to kind of gauge the severity of the injuries to the victim. And that knowledge is also important to convey to the paramedics when they get on scene, because the victim may be reluctant to give that information up.
It may not be easy to determine if someone lost consciousness. Due to a lack of oxygen to the brain, victims may not remember being strangled or passing out. Consider asking if the victim remembers any pressure being applied to her neck by any means. If so, how did that make her feel? Did she feel any pain or discomfort? Any difficulty breathing, catching her breath? Any trouble swallowing? Was or is the victim coughing, clearing her throat? Did she feel dizzy, lightheaded? Did she experience any vision changes, voice changes? Did she feel like she was going to urinate or defecate? If the victim urinated or defecated, she may not want to tell you, so you may need to ask if she changed her clothes. There are many more questions to ask to determine internal injury. Please review the First Responders brochure that the Institute has prepared and is now available on our website.
I'm Deputy District Attorney Brian Erickson with the San Diego County District Attorney's Office, Family Protection Division. Every year, 40 to 50% of 911 calls that are responded to are domestic violence related. Together, we can work as a team, and the information that you gather in saving these people's lives also can be used in prosecuting the people that did this and can hold them accountable for their actions as well. So the information that you gather is very important, and your job is very important as well. But we are aggressively prosecuting these cases as felonies, and as a team, we can do this together. San Diego has a new countywide protocol on the handling of strangulation assaults. It was approved by the Chiefs of Police, Sheriff, San Diego District Attorney, and the San Diego City Attorney. There is a specialized strangulation document form for law enforcement to use as part of their investigation, but it's also a good form for anyone to use. It has specific questions related to strangulation and places for you to document your observations.
Let's watch 2 mock courtroom scenes now from our Training Institute on Strangulation Prevention. The first, where a poorly trained paramedic has to face the consequences in court of a poor on-scene assessment in a near-fatal strangulation incident. Good afternoon, Mr. Mendler. How long have you been a firefighter paramedic?
I graduated academy in '98.
And have you received specialized training in the handling of incidents involving domestic violence injuries or strangulation assault injuries?
There was some brief training during the paramedic program back in '88, and then various programs that were put on by hospitals. An hour here, a half hour there.
So did you respond to an incident on February 10th of 2016 in San Diego where you were dispatched on a call where the allegation was that a woman had been assaulted? You remember that?
Yes, sir.
And when you arrived that day, did you contact someone?
We contacted dispatch, and obviously when we were dispatched and when we arrived at scene.
And when you got to the scene, who did you talk to?
There was a police officer that met us on the sidewalk and gave us a brief report of what was going on.
And did you ultimately have a conversation with a woman named Rena Hernandez?
I believe that was her name, but I cannot 100% remember her name.
When you contacted Rena Hernandez, did you have a conversation with her about what had happened to her?
There was a conversation that included a brief evaluation and an examination.
And what was the nature of your evaluation?
We were trying to determine if she was injured and if she needed medical care.
And did she tell you that she was injured or needed medical care?
She said there was no injury, she did not need help, and that she was not in any pain at all.
Did you do a medical assessment of her of any kind?
We evaluated her level of consciousness, if I remember correctly. But if I remember correctly, she was alert and oriented and she refused care.
She refused care?
She said that there was nothing wrong. She was alert and oriented to person, place, and time, appropriate, clear speech. And per the protocol and the policy, she had no chief complaint. She was a non-patient.
She was a non-patient? Is that what you just said?
She was not injured. She was not a patient under the criteria. And we made it an aid not needed.
And did you ask her your 3 questions that you just mentioned?
3 simple questions.
What did you ask her?
Her name, the place where she is or was at the time, and the date.
Were you aware at any point that she had actually been assaulted? Did you know that she'd been assaulted?
The officer told us that she was roughed up and there was some sort of an assault involving a person that was possibly a domestic violence incident, but we were never given any details as to the extent of any of the assault details or the injury details.
And did you make any effort at all to do an examination of her that would have shown you whether or not she had any kinds of injuries from being assaulted?
Of course we did. We asked if we could take vital signs, and the person refused multiple times. We advised her of the risk, complications, and consequences in a roundabout way. She said she didn't need help, she didn't want help, there was nothing wrong, and she asked us in a nice way to leave.
Did you become aware at any point that she had petechial hemorrhages from having been assaulted?
Not until about 3 weeks ago when I was subpoenaed.
So you weren't aware that she had been assaulted with petechial hemorrhage and with bruising on both sides of her neck?
No, sir.
And if you had known that she'd had petechial hemorrhages on her neck, would that have changed the way you handled the case?
We probably would have been a little bit more concerned.
A little more concerned?
Well, she would have obviously had an injury, and if you have an injury, you're technically a patient, regardless of whether you're alert and oriented.
Are you aware that a petechial hemorrhage means that someone has suffered what's called an anoxic event, which means that she may have suffered brain damage from the assault?
I am now.
Now let's watch the second mock courtroom scene from our training institute when a well-trained paramedic is able to testify effectively based on a thorough and complete on-scene assessment.
Can you tell us what you do for a living, sir?
I'm a firefighter paramedic for the city of San Diego.
And as part of your duties, do you respond to incidents where you have to provide medical care?
All the time, every day.
Approximately how many would you say you've responded to in your career?
Tens of thousands.
How many of those involved assault behavior?
Thousands.
And on February 10th of 2016, did you respond to assess a female patient by the name of Rena Hernandez related to an assault?
Yes.
When you responded to that location, did you notice the female? Where was she?
She was in her living room, I believe.
And what, if anything, did you notice when you first saw her?
She was obviously distressed. She was by herself.
Why do you say she was obviously distressed?
It appeared that she had been crying and she was somewhat semi-emotional.
Did you notice anything about her person in terms of your training as a medical care provider?
She was a female in distress.
Did you notice any injuries to her person?
Not until we started our examination.
What's the first step you took?
I asked her name. If she can answer her name and she seems appropriate, that's a pretty positive sign right there.
Okay. And what was her demeanor when you asked her her name?
She was extremely upset for the most part.
When you say upset, what do you mean by that? Was she angry?
She seemed anxious.
Okay. And did she describe to you anything that she was concerned about?
Well, from a distance, everything seemed fine. She was alert and oriented. She had great skin. She was obviously breathing. And I would say that from 5 or 10 feet away, I could see that she was stable. She originally said that there was nothing wrong, and she didn't call us and wanted us to leave.
Two things you mentioned there. First, you said from a distance she seemed like she was okay. Did you have an occasion to examine her more closely as a part of your medical care program?
I kneeled down next to her and eventually was able to take a brief evaluation of her heart rate from her wrist.
What about physical injuries on her person? Did you observe any?
Well, before we noticed any injuries, she confirmed the fact that she did in fact have neck pain, and she did in fact have difficulty speaking, or at one point difficulty swallowing and difficulty breathing.
Okay. And were these of concerns to you?
Yes, they were.
Did you examine her head and neck area?
Yes.
What did you notice when you examined that?
Well, she had discomfort to the back of her neck, she had discomfort to the front of her neck, her jaw, and on a further examination, she had redness behind her ear, and I guess the new term would be petechiae, where she had what appeared to be like hemorrhaging of her capillary blood vessels.
Was that significant to you?
Yes, and she even had some ecchymosis, which would be considered what everybody calls a bruise, and maybe some swelling, edema to the area of her neck.
And why was that of concern to you?
Well, there were significant forces applied to her neck by, I guess, the assailant's hands.
Did this cause you to be concerned for her well-being?
Of course it did.
Why is that?
Because she could have a life-threatening injury, and she, at the minimum, at least, had some sort of an injury to her neck, to some degree.
If there is any interruption of the blood flow to and from the brain, is that a life-threatening issue for you as a medical care provider?
Yes.
Why is that?
The brain needs oxygen and other blood flow, nutrients, including sugar, to survive.
And what happens if you cut off that blood flow?
Brain cells die.
Is that a life-threatening injury?
The more brain cells that die and the longer you have no oxygen, the less chances you have of surviving.
Surviving? You mean you could die from this?
Yes, you could.
Does that trigger any type of change in the way you approach the evaluation of this patient?
It already had, because once we realized that she had an injury and she told us about the mechanism of the injury, we realized that she was indeed a patient and she needed to be evaluated by not only us, but be transported to a hospital to be evaluated by a doctor.
Why does she need to be evaluated by a doctor?
But I don't have the tools and x-rays and CAT scans.
So when you talk about not being able to do a CAT scan or an x-ray, when someone has had the blood flow to their brain obstructed in some way, or the blood flow from their brain obstructed in some way, can there be injuries internally that you can't see externally?
If you have a bruise on the outside, chances are there's something going on the inside, and you need to have that evaluated. You need x-rays at a minimum.
And with this particular patient, you observed bruising on the outside, didn't you?
Yeah.
This training video has been designed to help improve the response to the handling of strangulation cases in San Diego. We need your help now to take this information, spread it far and wide, and implement it into your practices in the San Diego Police Department and San Diego Fire and Rescue in the response that we are providing to survivors of strangulation assaults in San Diego. We have the opportunity, by what we're doing here in San Diego, to not only improve our response to the handling of these near-fatal and non-fatal cases, we have the opportunity to set a standard for the entire United States, because nobody is paying the attention to this that they should be paying. This is life and death. These situations are very much the edge of a homicide. And if we can provide a trauma-informed, excellent medical response, diagnosis, and treatment model here for these kinds of cases, we can ultimately save lives. We can save the lives of survivors, we can save the lives of children, we can save the lives of police officers that often die at the hands of men who have strangled women. We need your help in order to see this become best practice across San Diego County. If you invest yourself in this and apply everything that we've talked about in this training, one day there will be people alive today in San Diego because of your investment and commitment.
You know, ultimately, the thing I'm going to remember the most is the team and the relationships I formed here, and that we're going to be carrying on. When we say we're in now.